In the second half of this week's material, we are going to investigate the respiratory system. So the overall functions of the respiratory system include providing oxygen to the body's tissues. So it's in our lungs where gas exchange occurs, in the very tiny air sacs called alveoli. It's here that oxygen is going to move from the alveoli and from the air that we inhaled into capillaries that are found surrounding the alveoli. And this is how oxygen moves into the bloodstream. That blood is then mobilized throughout the body, and the oxygen is delivered to our tissues. The respiratory system is also involved in maintaining acid-base balance of the blood through regulating carbon dioxide levels. So here we can see a photo demonstrating some structures of the respiratory system. So we can see the pharynx, which is the region at the back of the throat. The larynx is visible right here. And as we move downward, the trachea is this main windpipe, if you will, that branches off at the carina, the structure here. And so going into each lung is the right and left bronchi, or bronchial tubes. Those are the airways that bring the air into each lung. Bronchi branch off into bronchioles, which are just smaller branches, and like a tree, they branch further and further. And we can see these very tiny airways, these bronchioles, as they end at an alveoli. Within a cluster of alveoli here, there are individual tiny air sacs. And so these tiny alveoli sacs are where gas exchange occurs. So respiration is referring to this process of gas exchange. This happens in two major kind of regions, if you will. So external respiration is referring to gas exchange that occurs in the lungs, specifically between the alveoli and the capillaries that are associated with the alveoli. So oxygenated air is brought into the lungs, deep into the alveoli. That air, again, contains oxygen, which moves from the alveoli space into the capillaries. At the same time, carbon dioxide waste is eliminated from the bloodstream, and it moves into the lungs to be exhaled through breathing. So this is external respiration. Think respiration that's occurring between the bloodstream and the alveoli make contact with our external environment technically, right? They're within the open system that is the respiratory system. So the external air is breathed into the alveoli, and that air contains oxygen that moves from the alveoli and into the capillaries. So that's external respiration. As we know, the pulmonary veins bring blood back to the heart, specifically into the left atrium, which goes to the left ventricle, and then is pumped into the systemic circulation. Now, systemic arteries are going to branch off, and arterioles will then become capillaries, and capillaries are found within our tissues to deliver oxygenated blood to our tissue cells. So gas exchange that occurs between tissue capillaries and the cells that make up those tissues is a process called internal respiration. In internal respiration, oxygen moves from the bloodstream, because now this blood is oxygenated as it went out to the lungs, picked up oxygen, and is pumped through the body. So that oxygenated blood travels to the tissue capillaries, and the oxygen moves into our tissue cells. At the same time, metabolizing cells produce carbon dioxide waste. That carbon dioxide moves from the tissues into the bloodstream. And as it gets broken down, it moves back to the heart. That deoxygenated blood is pumped back to the lungs, and that carbon dioxide is eventually exhaled. So internal respiration is referring to this gas exchange event that is representing really gas exchange and the process of respiration, right? So taking glucose and oxygen, cellular respiration to produce carbon dioxide, water, and energy. But internal respiration is specifically referring to this gas exchange event happening deep in our tissues. So I've already mentioned briefly some of the anatomy of the respiratory system. I'm not going to go too deep into this, but relevant to what we're going to be talking about today. So here we see the pharynx again, which begins in the nasal cavity and extends to the larynx here. And it's divided into 3 regions. The nasopharynx is the upper portion that is behind the nasal cavity. The oropharynx is this middle portion that is in the oral region or behind the tongue. And the laryngopharynx is right here, just above the larynx or behind, above this region. So the larynx, represented by the combining form laryngo, we've seen laryngitis before, for example, is a cartilaginous structure that is found below the pharynx. And this is where your voice box is located. And the voice box contains vocal folds, which control speech. So the larynx helps to regulate airflow and also is where the vocal cords are found to regulate and control speech. Over here, we can also see the epiglottis. So it's this kind of blue flap here. And it's an important structure in preventing food and liquids from entering the trachea. So when you swallow, the epiglottis covers the trachea or the airway here. So that prevents the food that you're swallowing or the water that you're swallowing from entering your airway. And so if you hear that saying, oh, the food went down the wrong tube, if any food or water slightly bypass the epiglottis here, this triggers a coughing reflex to expel those substances from the airway, and they should go down the esophagus to lead to the stomach. So, in addition, your trachea here, or tracheo, also referred to as the windpipe. The trachea extends from the larynx to the lungs. And a branching occurs at the bottom of the trachea. We can see all of the cartilage that surrounds the trachea to provide some structural support. And the trachea branches into the right and left bronchi. These structures further branch off into bronchioles, as I said before, and alveoli. The alveoli are the tiny sacs where gas exchange happens. So this is essentially the pathway of airflow through the respiratory system. So this animation shows a bolus of food that is being swallowed. And we can see this is the tongue. That food is going to move down into the esophagus. And we can see the epiglottis. Can you see that little flap? It's highlighted with the line that says epiglottis. And we see the epiglottis cover over the opening here to the trachea, preventing the food from going down the trachea and keeping it going down the esophagus. And if you would like, I've linked a video here that shows the vocal cords in action. So you can actually see what the vocal cords look like and how they move or vibrate when an individual is speaking. So in order to generate speech sounds, the vibration of those vocal cords. So I summarized this on the previous slide, but just showing some of the combining forms here for bronchi, those airways, the alveolar sacs and alveoli, lung represented by the combining forms pneumo or pulmono, alveoli, those small sacs where gas exchange occurs. Pleura refers to the membrane that surrounds the lungs and also lines the thoracic cavity. It is filled with a fluid that prevents friction as the lungs expand and contract. So its purpose is to cushion and protect the lungs. And finally, the diaphragm, by combining form phreno, because the phrenic nerve is what stimulates the diaphragm. It's where that combining form comes from. But the diaphragm drives respiration along with those intercostal muscles that move the ribs. So as an individual inhales, their diaphragm flattens and moves down, which helps with expanding the volume of the thoracic cavity. And as you exhale, the diaphragm curves and moves upward, which aids in the expelling of air. So here we see some of these combining forms that I've just mentioned. Something I didn't just mention is tonsillo, which is referring to the tonsils. So a tonsillectomy would be the removal of the tonsils. We've seen these other ones. We've seen rhino, referring to nose. Rhinitis would be inflammation of the nose. Naso is also referring to nose. And we talked about cyanosis on a previous slide, but cyano means blue. So now let's look at common pathologies of the respiratory system. Now that we have reviewed some of these structures. And just so you know, I did reorder the slide after posting the slides here, so they'll look slightly different in this video. But I just slightly reordered them to put the slide on COPD, somewhere where I thought it made a little bit more sense. So just make note of that as you're going through this video. So we're going to start with two conditions here. Now, to understand respiratory disorders, we have to look at how the lungs may lose their ability to perform their main function, which is gas exchange. So two of the most common ways that gas exchange is interrupted is through atelectasis and emphysema. So here we have atelectasis and emphysema listed here. So on the left, we have collapse. So the word literally means incomplete expansion. It occurs when the tiny air sacs, those alveoli, within the lungs deflate. So we can see here they are nice and inflated. And on the right, collapsed alveoli, they are deflated. Or they fill with fluid. It can affect a small area, or it can affect the entire lung. So we can see this collapsed lung here is smaller in volume because those alveoli contribute to generating surface area for the lung. So once they collapse, now the overall surface area for gas exchange to occur is much smaller. So imagine a bunch of grapes, as the alveoli look like, where some of the grapes have shriveled up. So because these sacs are collapsed, they can't take in oxygen. And this leads to a drop in blood oxygen levels. Now, on the other hand, emphysema refers to the permanent destruction of the alveoli. So this is where essentially the walls separating the alveoli, or between the air sacs, are physically destroyed. So instead of many very small, elasticy little sacs here, we end up with a few large and more floppy pockets, if you will. And so the result is that the lungs become hyperinflated. They can get air in, but they can't easily push that air back out. So this trapped air makes the lungs actually look larger on an x-ray, but it makes them much less efficient at moving oxygen into the blood. So in emphysema, again, the alveoli become destroyed and the lungs are very hyperinflated. And instead of many small air pockets, which is the normal case, there end up being larger air pockets that are present. So these two cases in general are referring to disorders that interfere with gas exchange, specifically influencing the surface area to volume ratio of the lungs. Now, let's look at certain disorders or things that irritate our respiratory system. So, substances that cause just general allergies vary greatly depending on the individual. However, this can often include things like pollen, grass, insect stings, pet dander, some foods. So some allergies are mild, and taking a weak antihistamine like Benadryl can do the trick. But let's talk about a more severe case and discuss how histamine is involved. Now, respiratory failure isn't always necessarily a more slow process. Sometimes it can be sudden. And a systemic reaction to an external trigger may occur. And so let's talk about a regular allergic reaction. So it begins when an allergen, such as bee venom, enters the bloodstream and your immune system overreacts. This causes cells called mast cells that exist within our immune system to release many chemicals. And primarily the chemical histamine. You may see in these cases some localized redness, rashes, or severe itching on the skin, for example. Now, anaphylaxis is when this reaction goes global and it affects multiple systems at once. So there are many manifestations of systemic anaphylaxis. In the circulatory system, blood vessels dilate very rapidly. This causes a massive drop in blood pressure, which can lead to loss of consciousness. This is that anaphylactic shock, right, that we discussed earlier, associated with those massive drops in blood pressure, clamminess, kind of thready breathing, or the pulse, thready pulse, the pulse is weak. The respiratory system is affected as well. So smooth muscles in the airways constrict, called bronchoconstriction, the constriction of the bronchi and even the bronchioles, causing wheezing, making it difficult for air to move. And if the reaction continues, it can lead to asphyxia. This is a condition where the body is deprived of oxygen while carbon dioxide levels spike. In anaphylaxis, this is often caused by the obstruction of the breathing passageways, right? So as the lips, tongue, and throat swell up, and this causes the individual to stop breathing entirely. So asphyxiation is where the individual is not breathing due to the obstruction of the breathing passageways. This is a medical emergency that requires immediate attention, and epinephrine or an EpiPen can be administered to reverse the swelling in the airways and help to stabilize blood pressure. So this severe reaction to an allergen includes many signs and symptoms such as loss of consciousness, shortness of breath, lightheadedness, hives, rashes, airway constriction, again, a rapid, weak pulse, nausea and vomiting. So it's a very systemic process, but it does have very negative consequences and manifestations on the respiratory system. Now, for the next few slides, we're going to look at some cases that involve inflammation as well. And asthma is a chronic disease that is characterized by inflammation of the airways and constriction of the bronchioles, which can inhibit air from entering the lungs. There's also excessive mucus secretion with asthma in the respiratory tract. So we see this thick mucus production here in the bronchi here in the bronchiole. And this further blocks the airways. So symptoms of asthma include coughing, shortness of breath, chest tightness, wheezing, a lot of mucus production. And again, it's this chronic condition that can be characterized by periodic or reversible attacks. So during an asthma attack, your airways are essentially reacting to a trigger like dust. Even extreme exercise can trigger this, or cold air. So 3 specific things are really happening when an asthma attack occurs. Bronchospasm, refers to when the smooth muscles that wrap around the airways tighten and squeeze. So think of this as that constriction that is visible. So here we have the bronchospasm, right? The constricting happening to the bronchi. In addition, the inner lining of the airway becomes very red and swollen. We see some swelling here and narrowing, right? And finally, mucus production. So the body produces really thick, sticky mucus that can physically clog the remaining opening. So because the air is being forced through these tiny constricted openings, it creates some distinct physical signs that we saw. Again, that wheezing, right? The shortness of breath, coughing. And rescue inhalers work really quickly to relax or reverse those. So reverse the tightened, smooth muscles. So in terms of the causes, medical experts actually don't really know the exact single cause of asthma, but it's believed to be a combination of genetic and environmental factors. So early life exposure, perhaps, like frequent viral respiratory infections, or exposure to tobacco smoke early in life can affect how the lungs and immune system develop. But in people with asthma, the immune system essentially overreacts to substances that are normally harmless. And that is what is occurring with asthma, causing this inflammation, bronchoconstriction, mucus production, two common triggers. Now, we've seen on previous slides emphysema, right, which is that destruction of the specific little sacs within the lungs, the alveoli. Now, let's look at kind of an umbrella term for these things, like emphysema and also chronic bronchitis. So that is chronic obstructive pulmonary disease. COPD is a chronic inflammatory lung disease that causes obstructed airflow from the lungs. And again, it's actually an umbrella term that usually indicates two conditions: chronic bronchitis, which we'll see on the next slide, and emphysema, which we just saw. So again, in a healthy lung, the airways, specifically the bronchioles, are very elastic, and they lead to these tiny air sacs called the alveoli that inflate and deflate like balloons. In COPD, the bronchioles become inflamed and they lose their regular shape. They also often become clogged with excess mucus that we can see here, making it physically harder to get air in and out. The walls of the alveoli become destroyed, as we saw with emphysema, specifically the merging of the many small sacs into fewer larger ones. This drastically reduces the surface area that's available for gas exchange, because the more small sacs you have, see how many more surfaces or membranes are present here for gas exchange, compared to here where the alveoli have collapsed to form one, slightly larger sac. So reducing the surface area available for gas exchange means a reduction in the amount of oxygen entering our bloodstream. Because the body's struggling to get oxygen and vent or remove carbon dioxide, symptoms such as that classic quote-unquote smoker's cough, so smoking is a very common cause of chronic obstructive pulmonary disease, causing emphysema, chronic bronchitis. So that chronic cough that produces significant amounts of mucus, wheezing and tightness because of the altered shape of the bronchioles, and also because of a lot of mucus within these tubes. And as we saw with heart failure, cyanosis is also observed here because of the lack of oxygen, causing a bluish tint to the lips and fingernails. Now, COPD, if it's occurring long term, can also lead to right-sided heart failure and foot edema, swelling. Because the lung tissue is damaged, the blood vessels in the lungs constrict, and this forces the right side of the heart to have to work a lot harder to send blood to the lungs. So now we're seeing this connection between systems, right? How dysfunction in the respiratory system influences our circulatory system and influences heart function. So again, chronic obstructive pulmonary disease is this umbrella term for mainly emphysema and chronic bronchitis, where you have a lot of destruction to specific structures in the airways, such as the bronchioles, bronchi inflammation, and alveolar destruction. So we've looked at inflammatory conditions, right? Asthma, COPD. Now let's look at some infectious conditions. So conditions like bronchitis, pneumonia, and tuberculosis occur when pathogens such as bacteria or viruses invade the respiratory tract. So in bronchitis, this is involving inflammation of the lining of your bronchial tubes. And the difference is that while asthma causes those spasms that we saw and the wheezing and so forth, bronchitis is more just associated with the physical swelling of those tubes. So this can be caused by a previous infection, for example. So if an infection, such as a viral infection, is pretty severe, it can lead to the development of bronchitis, where you have this inflammation of the bronchial tubes, specifically the lining of the bronchial tubes. And acute bronchitis is shorter lasting, but chronic bronchitis is more longer lasting inflammation of the bronchi. And if it's chronic, it can be associated with something called hemoptysis, which is the medical term for coughing up blood. If the bronchi are inflamed and irritated for an extended period of time, that means inflammation is associated with, of course, more blood being brought to the area, and that inflamed tissue is more susceptible to becoming damaged or tearing, and this can result in the coughing up of blood. Now, unlike bronchitis, which is specific to the bronchi, those tubes, pneumonia reaches the alveoli, so the air sacs. And the result is that the sacs fill with fluid or pus. And this is clearly visible on chest x-rays. So here we see an image of a chest x-ray, and it appears as cloudy or white patches where the lungs should appear clear, and when they're clear, they look more black. So this cloudy white patch is an indication of fluid or even scarring that is happening in the lungs due to the infection, this pus and fluid. So because the sacs are full of fluid instead of air and this mucus and infection, oxygen cannot cross into the blood as efficiently, leading to severe shortness of breath and fever that's often associated with pneumonia. So with pneumonia, we have a deeper infection in the alveoli and inflammation of the alveolar walls as well. And finally, tuberculosis. So tuberculosis is caused specifically by the bacteria Mycobacterium tuberculosis, or TB. And it primarily impacts the lungs, but it can spread as well. It's very contagious and creates what's called granulomas, which are small areas of inflammation that can permanently scar lung tissue, kind of like how pneumonia is associated with lung scarring. Tuberculosis often develops from a cold and is actually a quite common pathology, but it is going to cause classic respiratory inflammation and due to the infection being present. So there's going to be inflammation of the lung tissue and increased fluid and mucus, and this can lead to permanent scarring of the lung tissue as well. So again, these particular disorders here are associated or commonly associated with infections. Bronchitis, as we saw previously, can be caused by things like smoking as well, just that inflammation of the bronchi. But bronchitis can also occur in response to an infection. And we're going to wrap up our look at the respiratory system with looking at conditions that are often associated or observed in cases of physical trauma. So we've discussed how the lungs can collapse from the inside, right? The atelectasis. Now, let's look at how they can be essentially crushed or compressed from the outside. The space between your lungs and your chest wall is called the pleural space. If something fills that space, it puts pressure on the lung, and this can cause lungs to collapse. So the first case here is a hemothorax. This is when blood leaks into the pleural space. We can see that here, the buildup of blood in the pleural space, usually due to chest trauma or even a ruptured major blood vessel. And the result is the volume of blood that's present there causes lung compression, right? So this blood is going to press on and put pressure on the lung. This leads to hypoxia, low oxygen, of course, because the lung can't expand to take in air as efficiently. If the bleeding is significant enough, it also leads to a specific type of shock. And I'm going to pause and have you think about what type of shock is associated with significant bleeding. And if you said hypovolemic shock, you're correct. That low fluid volume state of shock that we covered earlier. Now over here, this illustration is showing what occurs with a pneumothorax. A pneumothorax is when air enters the pleural space. So now air is entering that space between the lungs and the thoracic wall, often from a chest injury, so like a penetrating chest injury or blunt trauma. And the result is that air fills the cavity. As air fills the space between the lungs and the thoracic cavity, so air enters the pleural space, this increases the pressure within that pleural space. So intrapleural pressure rises. And because the pressure outside of the lung is now higher than the pressure inside, there's an external pressure there, the lung simply collapses. The lungs require sort of a vacuum, if you will, to be able to expand and contract. And if that pressure is disrupted, especially the vacuum effect or the pressure that is within the intrapleural space, then this can cause lung collapse. If the air continues to build up without any means of escaping, it can actually cause a mediastinal shift. So remember, the mediastinum is the region within the chest where the heart sits. So the pressure can become so high that it actually pushes the heart and those major vessels associated to the opposite side of the chest or out of place within the chest. So while the causes are different, in this case, hemothorax versus pneumothorax, blood entering the pleural space versus air, both result in decreased venous return. So less blood returning to the heart because it's bleeding out of the typically closed circuit, that is the circulatory system. And in this case, it is influencing or putting compression on the vena cava because air is within that pleural space. So that air puts pressure on the major vessels such as the vena cava, decreasing venous return, decreasing the amount of blood that's returned to the heart. So because the heart and its entry veins are being squeezed by this external pressure, blood can't get back into the heart itself as effectively either. This leads to obstructive shock, right? Where the circulatory system fails because blood flow is physically blocked by the pressure in the chest. So that wraps up our discussion on pathologies associated with the respiratory system. And I've included summary slides on the respiratory pathologies, and earlier as well a slide on the cardiovascular pathology. So I'll update these summaries on Brightspace, as I think that they might not be present in the slide deck that I posted. So I'll update with the summaries, just highlighting the different types of failures and pathology. So mechanical failure, as we saw with atelectasis and emphysema, chronic obstruction or inflammation with asthma, chronic bronchitis, COPD, infections such as pneumonia, tuberculosis, and these emergent cases like anaphylaxis, asphyxia, right? Swelling the airways shut and a person's not breathing in asphyxia, or hemothorax and pneumothorax, which increase pressure on the lung.